Hi, welcome to my presentation, Why Should I Care About My Gut Health? I am Dr. Amy Nabrick, the founder and CEO of PIVOT Integrative Consulting. I earned my Doctor of Pharmacy degree from Creighton University in 2012 and have over 20 years of experience in community pharmacy. As an integrative pharmacy specialist, I empower my clients to discover root causes for their chronic conditions and improve their gut health using functional and integrative pharmacy recommendations. I provide more meaningful interactions, interventions, and connections while healing the gut using food as medicine. The objectives for this presentation are to answer these questions. What is your microbiome? How is the microbiome related to gut health? Why should you care about your gut health? What things can you do to improve your microbiome? How can PIVOT Integrative Consulting support your gut health goals? Let's start with the microbiome. What is the microbiome? First, it's important for us to discuss a couple of terms. Some people use these terms interchangeably, microbiome and microbiota, but there is a difference between the two. The microbiome is the habitat of microorganisms, including the microorganisms themselves, their genes, and their environment. The microbiota refers to the actual microorganisms in a defined environment. So think of the microbiome like a house, which includes things like furniture and decorations, and the microbiota are the people and the plants and the animals that live inside the house, including some of those unwanted visitors like mice or cockroaches. So the microbiota includes bacteria, viruses, protozoa, and fungi. But aren't these the things that make us sick? There are some disease-causing microbiota in the gut. There are some of these pathogens which cause disease. One of the most notable is Clostridium difficile. Chronic use of antibiotics or stomach acid-reducing medications like proton pump inhibitors, things like Prilosec and Nexium, Protonix or Prevacid, increases the risk for C. difficile infections. There are some E. coli species. Specifically, there's the enterotoxigenic E. coli, which can cause traveler's diarrhea, as well as Shigella species. Salmonella, which is associated with poultry, and the feces from this infected poultry can cross-contaminate things like spinach and lettuce. We've seen some recalls for that recently. You also have things like Giardia, which is a waterborne parasite, adenovirus, which can cause many different types of symptoms depending on the area of infection. So it can be anything from bronchitis or pneumonia and cold and flu-like symptoms to acute gastroenteritis, which is the inflammation of the stomach or intestines, which can cause diarrhea, vomiting, nausea, and stomach pain. We also hear of things like the norovirus, which is common on cruise ships. It's where a lot of those associated diseases come from. And then we also have this special guy over here, which is the H. pylori. It is associated with ulcers, chronic gastritis, and stomach cancer. We also have some normal flora that is opportunistic. So it can cause disease if there's excessive colonization or a person is immunocompromised. So we have some of our bacillus species, staph and strep, as well as Pseudomonas. And then you also have these potential autoimmune triggers. So the Citrobacter, Klebsiella, Proteus species. If these get out of control, then they can actually cause illness. So these autoimmune associations, there have been many studies that have been done that have found that some of these bacteria can actually lead to or are associated with autoimmune conditions. So the Citrobacter, for instance, is associated with rheumatoid arthritis. Klebsiella overgrowth is associated with Crohn's disease, ulcerative colitis, and psoriatic arthritis. You also have some viruses that are related to other autoimmune diseases. So cytomegalovirus, CMV, is related to systemic lupus erythematosus, or type 1 diabetes, or rheumatoid arthritis. The Epstein-Barr virus has been found to be related to rheumatoid arthritis, lupus, Sjogren's disease, multiple sclerosis, and other autoimmune thyroid disorders. So with our microbiota, when our normal balanced microbiota is functioning well, it works in symbiosis with our body. We have trillions of microorganisms in and on our bodies, and they outnumber our own human cells 10 to 1. Most of these actually live in our gut. So let's talk about the good guys. Now that we talked about the ones that can cause disease, we should also talk about the good bacteria that lives with us. So there's going to be a lot of these crazy words on the screen like bifidobacterium and enterococcus, Clostridia. It's really not important if you know the names of these, but we are going to go over a couple just real special cases. So we have our friend the Akkermansia. This is one of the keystone species and a primary mucus degrader. It generates mucus-derived sugars and metabolic products that support growth and energy needs of other gut microbes. So it actually supports the growth of the good guys. It promotes mucosal health and mucus production in our guts, which is important for our barrier, which you'll hear about later. Low levels of Akkermansia are actually associated with obesity and metabolic dysfunction. So they've done some studies in some mice and some rats where they actually took fit mice and rats that contained a lot of Akkermansia species, and they did a fecal transplantation into obese mice and rats, and they found that the obese mice and rats actually started losing weight once the Akkermansia was presented to their biome. It's actually very interesting studies. So Akkermansia is definitely one of the good guys. We also have the Bifidobacterium species. Those colonize the human GI tract at birth. They're present in breast milk, and they're a common probiotic. They thrive on prebiotic fibers, so things like green bananas and a lot of our fruits and vegetables that have that good fiber in it. Low levels may result from low fiber intake or reduced mucosal health. High levels are more common in children than adults, which makes sense because if they're colonized at birth, you might see more in younger children. We also have our Lactobacillus species. Many of these strains are actually used in probiotics as well. High levels may result from reduced digestive capacity or excessive intake of carbohydrates. Low levels may be due to low carbohydrate intake or high salt intake. High levels may also indicate a reduced mucosal health, which we'll again talk about. That's part of our barrier system in our gut. And then we also have the other Escherichia species. So E. coli is the primary species in this family. And so we hear E. coli and we think about all the bad things about E. coli, but most E. coli are actually non-pathogenic. They're actually benign bacteria that just grow in our gut and are part of our biome. High levels, however, may indicate an increase of intestinal inflammation, and low levels may indicate a reduced mucosal health and decreased protection against pathogenic E. coli species. So how is the microbiome related to gut health? Sherry A. Rogers says, the road to health is paved with good intestines. So our microbiome, like I was speaking of earlier, has an intelligent barrier system. So when balanced, our microbiota lets in the good and keeps out the bad. Dysbiosis, or an unbalanced microbiome, can lead to leaky gut syndrome. It lets in the bad, and then we have increased systemic inflammation. The microbiome is also related to immunity and metabolism. Most immune cells in our body are actually found in the gut-associated lymphoid tissue, or GALT system. Specialized immune regions, called Peyer's patches allow for communication from this GALT system to the rest of the body. And that's what is found in that purple image with the arrow pointing at it. Those are the Peyer's patches. That is where we get a lot of our immune cells, and that's how our body communicates to our gut and vice versa for if we have any pathogens that might be found in our gut system. That actually leads to the cascade of ways of getting rid of those pathogens. Our gut microbiome also makes certain vitamins and neurotransmitters. So things like vitamins K, B12, thiamine, and riboflavin are made by the bacteria in our gut. Also, 90% of serotonin is made in the gut. So why should you care about your gut health? And what does all this have to do with me, you might be asking yourself. When your microbiome is balanced, foreign invaders have a hard time colonizing and wreaking havoc on your body. Many conditions are actually associated with poor gut health. The obvious ones are obesity and metabolic disorders, but there's also autoimmune disorders like the ones I mentioned before, rheumatoid arthritis, multiple sclerosis, and lupus. We have our inflammatory bowel diseases like Crohn's disease and ulcerative colitis. But since 90% of our serotonin is made in our gut, we also have mood disorders, chronic depression, and chronic anxiety. Patients with poor gut health might be more at risk for colorectal cancer. They might also experience skin disorders like psoriasis or eczema. They might have chronic allergies and asthma, or endocrine diseases like diabetes or thyroid disorders. They might be more prone to migraine headaches or hormone imbalances, which might include PCOS, which is polycystic ovarian syndrome, endometriosis, or breast cancer. So what can you do to improve your microbiome, you might be asking yourself? Well, eat a variety of fresh fruits and vegetables. As I tell my son, eat the rainbow. That's one of the best ways to improve your gut microbiota. Consume fermented foods, so kombucha, kimchi, kefir, miso, tempeh, sauerkraut, probiotic yogurt. Increase dietary fiber, which you will get if you're eating more fruits and vegetables. And eat plant-based carbohydrates. There are actually some specific foods that are beneficial for gut bacteria. Things like asparagus, green bananas, barley, beans, sugar beets, chicory, garlic, honey, onion, peas, rye, soybean, and tomato, just to name a few. Now, some of the things on this list I actually discovered I had sensitivities to, so I'm actually not able to eat some of these things, including barley, garlic, and rye. So you might want to get tested. There we are. Get tested for food sensitivities. Limit foods grown with pesticides, antibiotics, and hormones. So we have our dirty dozen, right? The strawberries, spinach, kale and collard greens, mustard greens, nectarines, apples, grapes, cherries, peaches, pears, bell and hot peppers, celery, and tomatoes. Those tend to have more pesticides than other fruits and vegetables. So it's a good idea, if you can afford it, to get organic on that list of the dirty dozen. You can also look it up online if you can't remember what I just said. So other ways to improve your gut microbiome: reduce stress. I know right now with COVID, things are very stressful, but find ways of reducing stress. Get adequate amounts of sleep at night. Get out into nature. You can actually increase your biota and your biome by getting out into nature and just becoming exposed to all sorts of the microscopic organisms that live out in forests and live out in nature. And if you need to, take a probiotic. It's recommended if you have 2 Lactobacillus species and 2 bifidus species in a probiotic. The more variety in the probiotic, the better. If you have a yeast overgrowth in your gut, you might also need Saccharomyces in your probiotic. So how can PIVOT help support your gut health goals? Some of the services that I offer are concierge consulting services, so we can take a deep dive into your health with a personalized consultation. I provide individualized care with one-on-one sessions, lab testing and reviews, and nutrition and supplement recommendations. So I provide multiple points of contact each month over 6 months to provide meaningful interactions and help you achieve your goals. If that's something you're interested in, please let me know. I also provide comprehensive lab reviews. So specifically on here, I will just skip through the highlighted ones. The gut microbiome, the GI map, or the food sensitivity tests. We can get those ordered and evaluated for you if that's something that you're interested in. I offer medication therapy management. So like I said, some medications might be affecting your gut microbiome. And so we can discuss some of your medications and see if there are anything that we can do about interactions or those insufficiencies. Speaking of insufficiencies, are you taking the right vitamins and mineral supplements? Some prescription medications, as I mentioned, can cause vitamin and mineral deficiencies, which can actually lead to gut dysfunction. So are your supplements adequate for meeting your specific needs? Here are some of the references from today's presentation. And thank you for listening. I really appreciate your attention. If you have any questions whatsoever, please don't hesitate to contact me. It is info@dramynafrick.com. Again, PIVOT Integrative Consulting. Let me know if there's anything I can do to help you.